When we first met Nick and Robert during the interview process, we were blown away by their sincerity and their drive. As you'll hear in Robert's presentation, they aren't exactly the typical med student. There was just one problem. They didn't really know what problem they were going to go out and solve. But at Dreamit, the most important aspect of all this is the team. And we knew that we had winners and that they would figure it out. And they really have. And they've used their experience prior to their medical school careers to come up and to identify a huge problem. And they've got a very innovative solution, and they're well on their way to solving it. So this is a team you're going to want to get behind. Please welcome Protenus.
Thanks very much, Jason. Hi, everyone. I'm Robert Lord. My co-founder, Nick, and I are medical students at Johns Hopkins who have put our studies on hold to tackle a huge problem in medicine today. Our company, Protenus, helps hospitals protect patient data in the electronic medical record. While the widespread adoption of electronic medical records has come none too soon, it brings with it a host of new challenges and new opportunities to breach patient data. Patient data breaches can absolutely wreak havoc on patients' lives and hospitals' reputations. This problem is an epidemic, and it's costing hospitals billions. In anonymous surveys, 90% of hospitals report having a data breach in the past 2 years, with the majority of these breaches coming from insiders. Looking at the costs attributable to data breaches, they average $1 million per hospital per year, but this number can range widely from $500,000 at a small community hospital to $10 million or more at a large hospital system. Broadening this out to the 6,000 hospitals in the US, that's $5.6 billion a year in damages attributable to medical data breaches. This is a huge problem. Other industries, though, have deployed solutions. You could look at the public sector or finance to say, actually, data breaches have gotten a little bit better. They've kind of tamped things down. Healthcare has not been so lucky. We have had a doubling of data breaches since 2010, and this shows no sign of abating, with increasing medical record adoption, as well as the fact that medical records are worth 50 times as much as financial records on the black market, creating a tremendous incentive for misuse and theft. Electronic medical records simply weren't built with security in mind. Traditional methods of role or attribute-based access control just don't cut it for the complex, coordinated, and interdisciplinary challenges that medical workflows face. This needs new solutions. It needs different solutions. It needs unconventional solutions. Luckily, we're all about unconventional solutions. In Nick's previous life, he served as a Special Forces operator, a Green Beret, with specialties in trauma medicine, as well as intelligence network building and analysis. In my previous career, I worked at a Connecticut hedge fund, where I built systems to analyze global governments. We think that there is no reason why healthcare does not deserve the same level of information security that we took as a given in our previous careers, and the Protenus solution will deliver just that. Right now, hospitals collect reams of data. It's unreadable, it's uninterpretable, and it's millions of records a day. What can they do with it? What the Protenus solution does with that is collects these data from across the enterprise. It standardizes, processes, and algorithmically prioritizes potential threats to the data system. It then develops actionable intelligence that's delivered to legal, compliance, and security officers for analysis and remediation. It does all this while keeping overhead and additional personnel down due to the inherent automation and intelligence of this system. Our initial efforts will focus on developing a retrospective solution for analyzing insider threats, but our long-term vision is the proactive cybersecurity protection of the entire hospital enterprise. Now, these are huge goals, but we have amazing partners. We are thrilled to announce, as of this morning, a partnership with Johns Hopkins Healthcare. We are really excited to be working with them and their capital, personnel, and systems to develop a first-of-its-kind cybersecurity solution and bring that to market. We are additionally delighted to be collaborating with Northrop Grumman, who will be lending their expertise, talent, and technology to accelerating our efforts. While talent, technology, and team is important, it's not quite enough to bring this vision to a reality, which is why we're also raising $750,000. This capital will be used for the deployment of our system at Hopkins and 2 additional sites within the next 12 months. We are looking for investors and partners that share our vision of bringing proactive cybersecurity solutions to healthcare. Thank you all so much for your time. Come find us later to learn more.